Hello, everyone, and welcome to the Operation Miss podcast, where we bring lovely, amazing people on to share their journey so that women, healthcare providers, families can learn from the amazing stories of the women that we're connected with. And so I am so honored today to see Miss Allyson and be able to talk with her because not only is her birth story amazing, but she is amazing. And I love taking every opportunity to chat with her. And I just think that the listeners, everyone listening, will get a lot out of her experience, not only as a labor and delivery nurse, but as a mom, as a sister, as a friend, as a wife. And so I'm super excited to have you on. Allyson, can you please introduce yourself to the listeners?
Yes, my name is Allyson Spear. I'm a nurse. I work at Atrium Health right now, but we'll see about that. Then I work. I got two sons. I have a almost 4 year old, and then I have a 4 month old. So there's that. And I'm married. We've been married for almost 7 years.
Wow.
Yes, I think I had to think about it. And yeah, that's about it.
Okay, so welcome.
Thank
Yeah, so let's just jump right in. Can you tell us, why don't we start with your experience as a labor and delivery nurse? So, how did your experience as a labor and delivery nurse inform the way that you went into your pregnancy and childbirth experience?
Um, I think as a nurse, you kind of give your patients the what they want, basically. At least for me. So if whatever they want to do, within reason, of course, we have protocols, policies, or whatever. And so that's what I tried. That's what I did for the patients. And how it impacted me was, um, I knew that I knew what I could do, basically, how far I could go, what I could do, being pregnant, being in labor. Um, so that kind of gave me like a little edge because I knew what they would go for. I knew what they wouldn't go for. Um, I think that being a nurse while being pregnant is different than just being pregnant. Um, especially being a labor and delivery nurse. I won't even say being a nurse, being a labor and delivery nurse. You know things, where things are headed when the doctor says certain things. You know what they're going to suggest based off certain data. So I think that it's kind of given me a power as well as like a disadvantage, if that makes sense. A disadvantage because I guess it takes the surprise at everything. You know what comes next.
Yeah, yeah. Okay. So, can you tell us, can you give us an example of data that might lead to something being offered or what they'll go for versus what they might not. So, what are some things that women who are not labor and delivery nurses could benefit from knowing going into their pregnancy or going into the delivery?
As far as pregnancy is concerned, keeping up with your blood pressures, um, especially if you know you have an issue with your blood pressure. I never had an issue with my blood pressure. My blood pressure actually goes lower when I get pregnant, so it starts off at lower, and as I progress, it does get higher, but it just stops in like 120s or so. But if you're not in the peak of health and you get pregnant, then your blood pressure is going to it's a chance for it to be go up. And then when you get to the doctor and you go to the appointments, they're going to be like, well, I see each time we're creeping up here. Then they'll start asking you to do urine and testing for protein and trying to get you to take your blood pressure at different times of the day to see if it's high when you do certain things or you're stressed out, stuff like that. Um, so that's one of the things that I feel like people don't know. And after that, it's coming to induction. And then they're also going to prepare you for a C-section because they don't want to put too much stress on you and the baby during the induction because the blood pressure is going to be out of control. And they already know this. And so, So once you get signed up for an induction and you have hypertension, they're gonna already put preeclampsia on there, and then they'll tell you, hey, you're preeclamptic. We're gonna try for induction, but we're not what is it positive that we're gonna be successful, and so we're gonna go ahead and do a C-section. So that's one of the things. That's just basically the cascade of events that
Right.
usually happens. And then as far as delivery goes, a lot of people go in with birth plans. Now, there's nothing wrong with the birth plan. You can have, but just don't be so strict about it, because in a hospital, there anything doesn't go basically. So you can't do what you want to do. Yeah, people want to walk around and do that. You can walk for a certain point, but if you get epidural, you can't walk. If you get epidural, you can't sit in the water. You can't get in the bathtub. In the hospital, once your water breaks, they usually don't want you to sit in the water. So it's certain things you have to know, going into a hospital setting.
Yeah. So first of all, I think the takeaway in terms of the blood pressure is try to optimize your blood pressure before you get pregnant. And
Try to
that
optimize your blood pressure as well as your health, your weight. For instance, people don't realize that weight plays a big role too. And I'm not saying you have to be some skinny mini or whatever and you work out I mean, but just have some healthy habits, because once you get pregnant, whatever you're doing when you get pregnant, I mean, as far as the routine goes, the max of that's the max of what you can do while you're pregnant. So you can't start Orange Theory when you're pregnant. You can't start calisthenics when you're pregnant. You have to do stuff that's not going to stress your body out.
Right, right. Yeah, I love that you mentioned that because some people they get pregnant unexpectedly and then they think, oh, well, I'll just go ahead and start getting really active when the body wasn't prepped for that pre-pregnancy. And so making sure to be active, hydrating well, drinking water, we always try to ask people, avoid those fast frozen foods, packaged foods, because we know that that has an impact on blood pressure. And so while research predicts that blood pressure will go down like yours in a healthy pregnancy, and then it comes back up around baseline around week 40, it's not the trend that we see sometimes, especially like you said, in women who either have suboptimal blood pressure going in or they're carrying multiples, right? Because they're at a higher risk of having things happen faster, blood pressure go up sooner. And so preparing for and preventing that if possible is great. So in terms of deliveries that you've seen, because when you mentioned epidurals, it's funny, a lot of women will say that the epidural is a non-negotiable, but they want to move around, they want to get in the water, they want to do all the things that do not go with an epidural in the hospital unless you have a walking epidural, right? But in your experience, how many labors have you seen that were completely natural, 100%, there was no intervention happen in your career in the
Nope.
hospital?
No intervention, and no, it's including epidural.
Yeah.
Um, Not many. Not many. That comes so when you have like a strict, this is just my opinion. When you have a strict way you want to do things with no knowledge, right? So I say I want to do this is my birthing plan. I'm going to the hospital, not getting epidural. I'm gonna push the baby out natural. Um, I'm gonna what else? I'm gonna be able to walk around, but women have to realize, in order for that to be true, you have to research, you have to know what you're getting into. People don't realize the amount of pain that childbirth brings, and it's whether you believe it or not, I mean, it's one of the worst pains you'll ever feel. Apart from having a kidney stone, it will kick your butt. That's what it's gonna do. It will humble you. You'll be thinking, oh, I got this. And that one good contraction hit you in your back. And you're gonna be sitting up there shaking the rails of the bed, talking about come give me whatever you got to do. And people don't realize that it that's what it comes down to.
So you feel like a lot of the intervention that is, well, let me ask you this. Do you see a lot of women offered inductions?
I see a lot of women want inductions.
Okay. And so what makes them come in and say, I want my baby to be induced? They're just
Tired
tired.
of being pregnant, or I want them born on a certain day, which I think is dumb. No offense. But my baby born on Christmas. That's dumb. Because you don't know, our bodies are designed to handle labor. Um, Especially, I mean, everybody's different shapes or whatever, and then some pelvises are, it's different and it's difficult to have to start labor. So you have to even think about that. But our bodies are designed, and so they know when they want to give birth.
Yeah.
And for us to try to put a date on it, to say, hey, I decided I'm gonna do it this day, you might not be ready, and you don't realize that caused you to have a C-section.
Yeah.
And that one decision, and people don't. And whereas if you would have waited and let it go in, most people gonna give birth between 40 and 42 weeks. This is what it is. Your body will, it'll start up, you know, contractions will start, or your water will break, and then, you know, just anything is possible. So I feel like people want inductions.
So
They're off, and the doctors are not going to deny you after a certain time, you know, for this induction. But you also have to remember this what people don't know too, that anytime they give you an estimated due date, it could be +2 on either side.
yeah.
So at 40 weeks, you could still be 38 weeks, or you could be 42 weeks. You don't know. And so for you to say, I want to be induced at 38 weeks, which I don't think they allow that anymore. I think it's 39 weeks you can be induced at 39 weeks, but not really knowing if um if the baby is ready. Even at 37 weeks, you still could have problems with the baby could still have problems.
Yeah, I love that you mentioned that because, of course, from our standpoint, typically, even just with our pledge, no routine inductions, no unnecessary C-sections, no unwarranted medical intervention. My body was designed to give birth. So from the beginning, we don't want people just saying yes to a routine induction, right? But most people who come to us from MIS don't want inductions. They're offered inductions and then they're having to turn inductions down. So for people
Mm-hmm.
who are listening, though, because I have heard too, a lot of women say, I'm just ready to be done being pregnant. And so when the offer is given, oh, well, the baby's healthy, you could get an induction and we can get the baby here faster. It's not always the optimal. It's just, it's like you said, the body is going to do it itself. And as long as your blood pressure isn't high or you don't have some other type of complication, it just doesn't make sense to rush getting the baby here. And so for the people who go in and ask for inductions, I'm so happy that you mentioned that, because from our standpoint, people who don't come to us who are asking for inductions, right? But they're out there. I know they're out there because I've seen people say, I want my baby born on Valentine's Day. I want them born on the day when maybe my mom, you know, passed. And so it'll be like a good gift of her, the baby. So like when you hear that, it's like you can't really argue with their rationale. But if you give them the facts, that your induction could turn into a nightmare. Because even if it doesn't end in a C-section, like you said, let's say baby is born and now baby has to go to the NICU. Now you're separated from your baby, and then that messes with another goal that you had. And so I just love that you brought that up, because we don't hear that perspective often. They're asking for it, but I also think that they don't understand what they're really asking for. Almost like a child who asks for candy every day. You may think that it's enjoyable, but when you got to pay for cavities and root canals,
Dental work. Yeah.
then as a parent, it's our job to say, no, I don't care what you want. Right. And so I think that we have women who are told, no, you will not be induced by their provider, because they know your body is going to do this. Just wait. And I think that maybe it just takes more people telling mom, just wait, you can do it, you know? But okay, so can you tell us about your birth? How was your second birth compared to your first? Can we talk about that?
My second one was easier than my first. My first birth, I felt like none of the labors were bad to me because I already know what to expect, I guess. And once I feel a contraction, this is just me. Once I feel a contraction, please epidural me. I asked the people, go ahead and get the fluid in me. I don't know how much fluid. I do know how much fluid. Go ahead and get the leader and to hook it up to the IV. And then I know how long you can't see, because if it's like an hour past, I don't even want no. Just hook the lead up and call the anesthesiologist to come on, and she gonna come put the epidural in my back.
Okay.
So my labors are fine, and I don't have the issue with. That's the other thing. People talk. I felt it on da da da. I felt this side didn't get number. This side, you have to. Now that's one thing that I can say. When you are getting your epidural with your anesthesiologist, and they're asking you, what side do you feel me on? You need to answer that appropriately. Don't say, oh yeah, I can feel it. Oh, if it's not in the middle, it's not in the middle. Just go ahead and tell them, because that's when they're guiding into your epidural space. Yes, it's funny and it feels weird, and it's like it's hanging down your legs because it's like a twinge, and they tell you that all kind of stuff. But if they put the catheter in and it's more on one side, you're only going to get relief on one side. So you have to know that when they say, hey, what side you feeling on? And then they'll adjust, and they'll ask you again, hey, what side are you feeling on? When I had my epidurals, it was a lady that I'd known when I was working. I trusted her. I didn't want nobody else to do it.
Mm-hmm.
I actually said if she wouldn't, which probably wouldn't a lie, if she wouldn't have been there, I wouldn't have got one. That would have been a lie. But if she had been there, I wouldn't have got one. But she usually hits the middle every time, so I don't feel it on either side, and I get numb on the whole body, be numb. So when they put an epidural, it didn't work for me, and that's true. But that means that's when you have to advocate for yourself, because I do believe that the epidural, if they don't put it in the right side, if they don't put it in far enough, depending on what kind of medication they're using, it's not working. You have to advocate for yourself to say, hey, this isn't working out. Hey, I need some more. Hey, you know what I'm saying? Like, so the epidurals made the labors. That's what we're getting back to. The epidurals made the labors good. The labor for both of them were long, because what that happened twice is my water breaks, but contractions don't start. So my water breaks, and I'm just like sitting there. They hoping something start off, and it's just like no. So with my first son, I took Cytotec, and I took Cytotec knowing that I would not that I wasn't supposed to take Cytotec, but I was already 100% in face. If that means that the cervix is really thin, and I was like 2 centimeters, 1 to 2 centimeters. Technically, you're just supposed to get started on Pitocin. But the doctor that I had that day, he wanted to do Cytotec, which is like a little pill you put on your tongue. I don't want nothing to do with Pitocin. That's just me.
Can you tell me why? Tell us why.
Because Pitocin is like which one of them? It's like that man that used to wrestle with that white hair. Now he got that white hair. You know that man I'm talking about. That's how I can compare him. How he used to throw them people around and beat them up.
Allyson.
That's what Pitocin is. It's like asking to be beat up. People don't realize. Let me tell you. I'm gonna tell you this story. I have a sister-in-law.
Uh-huh.
And she was preeclamptic. She gained all, and the people didn't realize she gained all this weight. People don't realize the weight is here. She gained all this weight, and it made her be preeclamptic. So at 38 weeks, she had to go in for an induction. She was high clothes and tight. I don't know why they put that Pitocin on her without putting something in to help soften it up first. But they put that Pitocin on her, and it did, baby. It took all their might, and see, she was going in all natural.
Wow.
And what she told me, they said they turned that Pitocin on, they cranked up to the highest they can get it, because you only start, they can go up to 20. They actually can go up to 30 if the doctor wants to. So they was at the highest they could get it. She said She said, I had to get the epidural because I didn't see it in this sight. Anytime somebody describes something like that,
Yeah.
you don't want any parts of that.
Yeah. Yeah. And when you see it used and see women's responses to it, right? And
You know what I'm
you
saying?
said
Like,
something though,
mhm.
high, closed, and tight. Because we've had some women who have advocated for themselves very well. And they get the Pitocin at a lower level, or, and then they have it pulled once they get into active labor. So it's like they have a more active role in how the Pitocin is used, right? Where most people are passively receiving Pitocin and they don't even know what's coming, right? Or how it's going to feel. But you said
Wait for
high,
it.
closed, and tight. So stop, Allyson.
What?
So essentially, if you're listening, that means the body was not ready to go into labor.
Ready at all. And
Was
but they had to do it. That's the thing. They had
Mhm.
to do it because she was preeclamptic. But that means that her cervix was thick. While you're pregnant, you want your cervix to stay thick. You want it to stay closed. You want it to be tight. All of them things. When it's time for you to go into labor, it's supposed to thin out. The cervix will dilate. It'll open. It won't be high. The baby's head is pushing down. When I mean high, I mean the baby's head is not high. It's coming down into the birth canal to sit. And with every contraction, what the baby is supposed to push on the cervix, which then activates certain hormones that cause the cervix to soften, which they call ripen, and then to thin and to dilate. That's what you want. But when your body isn't ready and then you try to make it do it, it's a forceful thing. So then it's like, we just gonna try to open up whatever we can open up. But sometimes when the body really isn't ready, it just does not respond. And with a higher dose of Pitocin, it does not make a difference. The higher you put it doesn't mean that you're gonna dilate.
Right.
All that's doing the body, how Pitocin works is it acts on receptors in the body to help to open the cervix. But you can wash those receptors so much with the Pitocin that they do not respond.
Right.
So you're just contracting, wearing out the uterus, wearing it out. People don't realize that you can do that too. You're wearing out your uterus to the point where it could get too tired, then you're in this emergency situation.
Right.
Or to the point where the uterus and the contractions are so strong that the baby is tired now, you're in an emergency situation. So, and a lot of times people say, I had an emergency C-section. I hear that all the time. You didn't have an emergency C-section, baby. They just told you that so they can go ahead and cut you. But then they was, I don't know what you be doing in there. Some people say emergency C-section, and I can already tell how they was in there. You could tell they were in there probably hollering and screaming. The trash was kicking their butts, and the people would get, the doctors would be tired, and they'll be like, "Baby, it done turned into emergency. You
Yeah.
got to go to the
Yeah.
back and have a C-section." So that's why you have to be mindful of what you want, what you ask for. You
Yeah.
got to be really mindful.
Yeah.
Even before you get pregnant, just know it could be 9, 10 months. It could be farther than that. I mean, well, not farther than that, not much farther, but farther than that. And you just know in your mind that my body will be occupied for that amount of time.
Yes.
And even after you give birth, your body is still not yours. I don't understand why people want to rush to get to the part where, I mean, the baby is great. Don't get me wrong. But you're trying to rush to get into no sleep, rush to get to taking 2-minute showers, trying to get
Right.
some, you know what I'm saying? Like, I understand it's uncomfortable, but there are ways to make things comfortable.
I
You know what
love
I'm saying? And I
that.
always tell people that when you get to the end, don't think about how every day, how can I get unpregnant? No, how can I make myself comfortable?
I love
That's what you have to work on.
I love that, Allyson. I love that mindset shift. First of
Yeah.
all, if we would stop saying 9 months of pregnancy, I think women would stop thinking like that, right? Because at some point, people got it in their head that they're not going to drink alcohol during their pregnancy. And it's because over and over again, they were showing outcomes that drinking during pregnancy is not a good idea. So you
Yeah.
still have people who drink during pregnancy, but it's within, like they know that they're putting themselves and their babies at risk,
Yeah.
right? I feel like if we would start just saying 10 months of pregnancy, and so it's just in people's minds it's 40 weeks, then they wouldn't have that problem that at 9 months, everybody's rushing them to have this baby. But the mindset shift of how can I get this baby to come? Because you know that's what happens 2 weeks before the due date. People are doing mile circuits, they're drinking all type of
Doing
different stuff,
squats, you drinking tea you never heard of before the people
walking
told you about.
everywhere,
You walking 10 miles a day. You ain't never did that before. Sit
spending
down.
your whole life on the ball, walking back and
you
forth.
you
You're right.
they
How do I
bounce
get
around the house trying to do housework. You squatting, walking up and down stairs. On the one that get me is you see people outside on that sidewalk talking about get girl.
get comfortable and wait? Just keep doing what you've been doing the whole pregnancy, which is living life.
Thing is, them the little what I realized. Because the one time when I then the first time I was like, man, actually the second one where I got real tired, my second pregnancy when I was tired at the end. Then I was thinking to myself, these little couple of days doing this stuff isn't gonna make a difference.
Yeah.
And the thing is, if you really do the research on the teas that you drink and only thing, most of the time, all those things are to optimize labor, optimize the uterus. It is not to send you into labor and it's doing all this. No, it is not some magical juice. It is just tea that strengthens the muscles in your uterus.
I love that you said that because even with things like, the mile circuit and other things that people do to move
Mm-hmm.
as the position of the baby, right? Like you said, in terms of like the baby's head knocking on the door, I think of the cervix as like a door. So it's like knocking on the door. And for about a month and a half before you deliver, it's knocking on the door. And so it's optimizing the baby's position, helping it get into a good position. It's lovely that you said that. It's funny because when most people ask us, what do I need to do? I'm like, go to sleep, get a good night of sleep. You need your hormones balanced to go into labor. And if you're staying up all night or you're tiring yourself out during the day, you're not getting good quality sleep. And so figuring that part out would be better, would be more effective.
Mm-hmm.
Walking 15,000 steps a day, right?
Especially if you did not even walk 15,000 steps. That's what people don't realize. And sure, I'm gonna say this right here too, because people don't know this part. You walk them, say you walk these 15,000 steps in a day. Okay, you ain't did that the whole time. Okay, now you get home, you sweating profusely. Then your stomach start contracting. You're like, oh, it did something. You go up there and I give you 38 weeks and 2 days, right? You contracting. You go up to Piedmont, wherever you're going, and you say, hey, I feel like I'm in labor. And they check you. And the same with you in the office, zero and closed. But you contracting. Mind you, put on the monitor, the heart rate good on the baby, the contractions every 2 to 3 minutes. The doctor gonna tell me, give her IV and start some fluids.
Wow.
I give you the fluids and the contractions cease. That just means that you were dehydrated.
Right.
You were not in labor.
Yeah.
They gave me the fluids and then the contractions went away. Baby, that's because that's what it was supposed to do.
Yeah.
Anytime that your body gets dehydrated, your muscles will contract.
Right.
It's not just your uterus. You try it in your leg. If you want a Charlie horse, try that.
Right.
And you pull up your hamstring, your muscles, they're gonna contract, and then there you are. So it could be in any muscle in the body, it's gonna contract.
Absolutely. Yeah.
When it's dehydrated.
I love that. Thank you for sharing that. Yeah. So, okay. So your labor, you opted to have cytotech. And then what happened after that?
First one, I had cytotech. I had 2 doses of cytotech. The first dose of cytotech got the contractions on. I got the epidural. The epidural didn't slow them down. Sometimes that does happen, but it didn't do that to me. And I took the second dose, and I was 5 centimeters when I took it. Yes, I was 5 centimeters. And I was rotating on, and I will say that I had my births at Piedmont, and they are very good because the nurses over there, I've worked with them as well as had a birth, two births there. So they are going to rotate you. They are very serious about their numbers. They are very serious about not having C-sections. So therefore, they're going to rotate you every 30 minutes on that ball. They're gonna be on the peanut ball. You going back and forth, back and forth. The first time I did that, well, my son was already low, and I felt like I was, I don't know. I was like epidural, and I told that to the anesthesiologist. She came and checked on me after she put it in, and that was that second dose of side take, and she was throwing me back and forth on this ball. And she said, "How you feeling?" I said, "He is pressing in the cervix like it would not let loose. Like it's just there." And I did not have any Pitocin with my first son. So this was just after this time, my body was actually in labor and it's trying to get this cervix going and he's pushing down on it, but it's just like it would not move. And so she was like, "I can help you out." Dr. Sanji, I'll never forget Dr. Sanji, she gave me some fentanyl. Okay. And that helped ease me off for a little bit. But it didn't last long because his head was big. That's what the doctors told me. And so it didn't last long. But then when they checked me, probably about 45 minutes, 50 minutes after I had that side attack, that second dose, I was like 9.5 centimeters. I was going back and forth on the ball, and the pressure, you could tell the difference once you get down there because it's like it's astronomical. I don't even know how to describe the pressure. They like the pressure, and that's what they used to tell us to tell the patients. And I was thinking it's the dumbest thing I ever heard in my whole life. The pressure's gonna feel like pain, baby. It is pain. It doesn't feel like pain. This is pain. And so I that's when they were like, just try to hold on. I was like, okay. So, and hindsight is 2020, and as you know, that was what was I had been out of labor and delivery a couple years by then, but I was not thinking when I was in it that I probably should have just sat there for a little bit after I became complete, because even though I had no cervix, he was still up there.
Gotcha.
He was up there. Now you can be 10 centimeters and push for 3 hours, or be 10 centimeters and push for 15 minutes. And the difference between that is, one, I had never been pregnant before. And when you're never pregnant before, your body doesn't know, like it hasn't never been through the motions. I won't say it won't know. It didn't know. It just had never been through the motions. So the muscles and the tendons and the tissues and the bones have to stretch to try to pull the baby out. And so I pushed for 2 hours and 11 minutes.
Wow.
From 5 o'clock until 7:31. That's when he came out. He was big, 8 pounds. He wasn't big as he could be, because some people's babies are bigger than that. But that's big for me. Okay. And so he was 39 weeks and 6 days. And so he was a decent size. He was 8 pounds even. And what was he? 21.5 inches.
Wow.
And it took all my might, 2 hours and 11 minutes of all my might, to get that boy out of me.
Yes, but I love that you said that though. Do you remember, first of all, I want people to hear 2 hours, 11 minutes, excuse me. And it was after you were already fully dilated.
So
Go ahead.
Go ahead. No, you go ahead.
So sometimes when a person is dilated, fully dilated, 9.5, or let's just say they're at 9.5, when the baby doesn't come right away, they get really discouraged. And unless they have a team that says, no, you're fine, we're fine, you can keep trying, let's rest and just see what happens, it can be really discouraging. So I like knowing the time frames. And then you said your water broke, but you didn't have to.
Water broke. Let me tell you the time frame.
Can you tell me? Okay.
Baby, because this was all day, next day kind of thing. My water broke at 4 a.m.
Okay.
4 a.m. got dressed, went to the hospital. My husband was like, please no, Allyson, because I'm tired. I ain't been to sleep. I said, that's on you. Okay. You should have went to sleep. I've been sleeping. You should have went to sleep. Okay, come on, let's go. So we got to the hospital about 5. They checked me, and I'm thinking, because my water broke. Oh, I'm
Right.
gonna be dilated. No, 1.5, 2 centimeters.
Yeah.
But 100% effaced, which means my cervix was almost paper thin. Because the first girl who checked me didn't know what she was doing. Ma'am, you got to go find somebody else. Because this is uncomfortable. You got to go find somebody who know what they're doing. I worked up here before. It's not you. And so they went and got the other lady. I knew her. She was the lady I worked with. She said, because she was like, I think you're complete. Ma'am, I don't think so. But just go find somebody else.
Yes.
And she came back and checked, and I was just like 1 2 centimeters. But because my cervix was so paper thin, that it made it where to feel like I didn't have any cervix. So then that was at 5, right? So I was there at 5 a.m. So
Right.
starting this whole process started at 4. Got in the room, got the first dose of side attack, probably around 9 something. Went through that first dose, got me to about 5 centimeters. Came back around, and he was not aggressive because I told him in the beginning, don't come in here, because the doctor that was on for me, it wasn't my doctor. Dr. Cox is my doctor. It was Dr. I said, because he sometimes get a little knifey, little. Don't come in here talking about no C-section. We only just started this process. Okay, I don't want to hear that. Don't tell me maybe we could. No, don't say that. So he didn't say it. He didn't mention it. And so he let me do whatever. If I was, he gave it to me around 9. Came back around 1, checked me. I was still contracting then, but it still was like moving slow with about 3, 3.5. Then came back around probably about 4, and that's when they gave me that second dose side attack. And then for those people who don't know, in a hospital, at 12 hours of water being broken, you have now added another day to your stay.
Gotcha.
Yeah. Because it's infection risk, and make sure the baby don't have an infection. They check the labs or whatever. And so I was there, instead of being 2 days, it was 3 days. So yeah. And so at 4 o'clock, that was 12 hours of labor. I was 5 centimeters, and they gave me that second dose, and I guess that was the one that put in high gear. And by 5, I was 10 centimeters. Not, yeah, 10 centimeters, and I started pushing. But even though felt like the baby was low, and he was low, but for me to have to push 2 hours, I probably was just at a 0 station, right? You
Right.
have to be +1, +2, +3, +4, then they're out. So if I'm at 0, we still up there.
Yeah.
And to push a baby down them many stations, I'm just like, that
Yeah.
was a lot.
And your water had been broken, because I feel like this process for people who like me, Victor's water broke while I was delivering. So like as I was, he just literally slid out, and it was like he was on a slide, versus what I feel happens in other people's scenarios where the water breaks so far ahead of time that now the canal is not as easy to get out of, right? Like it ends up being more work. And that happened with Krista. I felt the difference with her water being broken. I felt the difference in the contractions. I felt the difference in her coming out. It was very different because the water was not there to aid the process anymore by that time. Your second pregnancy, what made you say, let me have monitoring for the duration of the pregnancy? And then can you talk about how your delivery was different? Because I know you said the first and second were different.
Okay, so for my second child, when I got my second pregnancy, I you I didn't know that you did this for my first one. See, I didn't know about Operation Miss for my first pregnancy. And so I would have done it had I known that about it. But I just feel like when you're pregnant, especially if you've never been pregnant, um, having somebody who knows, been pregnant, knows about it, giving you information, and then also monitoring um your stress levels, monitoring your heart rate, monitoring how well you're charging, because as a pregnant person, your brain already gone. Just go with that. Just gone. You gonna try to say, "Oh, I can remember." You can't remember nothing. The things you think coming up with your mind don't even make sense. It just does. So, having somebody to monitor your stress, monitor how well you're sleeping at night, monitor how well you are getting back your charge, because that's what we call it, but getting back, regaining your strength for the next day. That's how I put it. Regaining your strength for the next day is a big help, because your mind isn't on that when you're pregnant. Your mind is on, how am I get to the next day? Especially if you nauseous, throwing up, if you're not drinking enough water, you're trying to go to work. If you have other kids, you got to try to deal with them. It's a lot. And so having somebody else to be there for you in your corner. Hey, maybe tomorrow you don't do nothing. Hey, have a massage, get your nails done. Maybe this will be what you need to do. Sleep. It makes a big difference. And then also for you to see the numbers. You know what I'm saying? You getting up in the morning, that's the first thing that you need to do. Hit your watch, and then turn and then sync your vibe. And once you see, oh, I'm only at 35. At pregnancy, that's where a lot of people live. Your body's doing a lot of work. And at night, your stress stays up because your body's still doing a lot of work. And so I feel like having somebody to tell you, hey, chill out.
Yeah.
And that makes a big difference. Because my Miss Minder, Dr. Amber, she was really good about that. And she was so nice with it, It's not like me. She was real nice with, like, hey, maybe today, are you planning any rest? Are you know what I'm saying? Stuff like that. For me, I mean, she could have been the other way, it'd have been all right. But for me, I've been like, hey, you need to sit down. Don't, yeah. I feel like that's one of the biggest things for me, was somebody reminding me, hey, your body's stressed out. Sit down. Because when you're pregnant and stressed out, that's a source of your blood pressure could be going up from that. And when you're pregnant and you're stressed out, your heart rate's up. And you're pregnant, you're stressed out, your mind's not resting, you're not sleeping well, your sleep quality is low. When you're not sleeping well, you're not charging well. And then the stress is up at night, you're not charging, then it's a cycle of just continue unrested body, trying to build a baby. That's what I call it, trying to build a baby. And then that opens a whole nother can of worms. And you don't want to put nothing into those doctors' heads that's not already there. I'm just gonna be honest. So yeah, it's important.
Her personality is so nice and so sweet. And so for people who need that, it's needed. Like sometimes during pregnancy, people are not the same as they are outside of pregnancy. So outside of pregnancy, you are very direct and you are very open to feedback, and right. And but that's your personality, and it didn't change during pregnancy, right? Um, but I love what you said. Like you didn't need that. You just needed the mirror. You just needed somebody to hold you accountable and remind you to rest, or to hold up a mirror to you so that you could make better health decisions. Okay, so fast forward to this delivery, because I don't know, I love hearing your birth stories. So can you share your delivery experience with us?
With the second one, with Ezra.
Yeah.
Okay. Well, my second delivery, let's see. Okay, so that labor was different just because I was I already knew what to expect. I knew, and so I was really chilling that time. And my epidural work, I got down to 7 o'clock, and it was shift change, and I was on pitocin. I didn't want to be on pitocin, but my doctor was like, "You shouldn't have ever been on Cytotec the first time. You should have been on pitocin the first time." And I was on somewhere. I said, "Okay." I said, "I guess I'll trust you." I do trust about Dr. Cox. I do trust her. So I was on pitocin, and I wasn't maxed out or nothing. I was just on a regular dose. I think I was on like maybe 10 and 12 or something like that, just a little bit. And the nurse, she was one of my friends, the nurse that took care of me, she was getting off, and I had been 6 centimeters at the time. It was 7 o'clock. And, but then the contractions, they were about the same or whatever. They was just coming. I was like, this doesn't feel the same as it was, because it was like more pressure coming down to the bottom. So I felt that a couple of times, a couple of them contractions. So I called the nurse, and it was coming for the night shift. And I told her to check me, and she was just checking. Now, mind you, I used to check people, so I know what checking feels like. Okay, and she checking and she down. I'm like, what is she doing? And she was like, well, I think that you might be complete. I said, it feels like that. And she was like, well, I'm gonna have to go and see and check. I said, okay, well, you better hurry up, because I feel like the baby's about to come out now. She was like, oh, okay. So she running outside to go get somebody. I'm still in there having contractions, baby still pushing down. And I'm looking, and I'm like, where is this lady? So she come back in the room, and she talking about, well, Dr. Cox said she's on the way. She didn't think, none of us thought this was gonna happen. Mind you, it's not the doctor's fault. We was all thinking 2 a.m. As slow as it was going, it seemed like it was gonna be 2 a.m. So I was like, as soon as I hit, but it happened with Micah too. It, like, when I got to like 6 or 7, it just shot on down the hill, like zoom, like it was quick. And so I told her, I said, I know I don't want Dr. Cox here, but whoever is out there, just tell them they can come in here if this need be, because I'm about to push this baby out now. And and she was like, okay. And so they were like, the midwife was out there. She was like, I was just gonna sit out there and wait to see if she was gonna need exactly. Dr. Cox come running in. She was like, I was not expecting them to call me. I was like, no, you weren't. Neither was I. And it took me only 15 minutes to push him out. So it was quick, way quicker than the first one. I also think when your body has gone through it before, it just goes ahead and does the necessary things. So I feel like those contractions were a lot stronger to push him down farther. So when it was time to push, he was out, because my water again was broken way before in the morning. I think this time it was broken at like 8. It broke, rather, not broken. It broke at 8, and that wasn't. It wasn't a whole 12 hours before. Well, just under 12 hours before he came out.
You could feel exactly where the pressure was to describe to the provider what was happening. And the second time, you could feel and could tell that you were ready to get the baby out. And so I feel like just being in tune with your body is so important. But sometimes I hear women say they can't feel anything with the epidural. So it's almost like people have to coach them through all the way. What is the difference? Why does that happen sometimes in other people? They can describe as vividly as you do what's happening. Is it an awareness thing, or is it a?
I think so. This is it's probably 2 or 3 things. One, I knew the minute I got pregnant, like the very minute. Like I felt my boob, it just descended on into my body, and like, oh, you're pregnant now. It was like my second time, I felt immediately my boobs, it changed just like that. I was at work and I said, oh, I'm pregnant. And
Wow.
so that's one thing. I feel like yes, I am in tune with my body. Now I'm not one of them people, oh, I track my cycle and I know the days and all this kind of stuff. But I know when I'm ovulating, I know when my cycle's about to start, I know stuff like that. So I knew when I got pregnant. So when it comes to like feeling different things, like I can feel different things in my body and I know, oh, hey, it's that or it's that.
Yeah.
So the baby coming down, I knew he was this time was lower than with Micah when I started pushing.
Wow.
I could feel I didn't have the oh he's about to drop out the back door feeling with Micah like I had the second time. The second time I was like, baby, you better go find somebody. You better go find somebody because I'm telling you right now, he's right there. And
Yeah.
so they were like, oh, okay. But the first time I didn't have that because I don't think I had felt it before. I didn't feel the back door feel until I had to push to get there. You know what I'm saying? I felt the pressure, but they told me I was 10 centimeters, not that I could feel that I was 10 centimeters.
Gotcha.
And
Gotcha.
and then the second thing is it depends on the hospital. And that's why I only choose to deliver at Piedmont is your epidural. Yes, I do have epidural and some people do, but you also have to realize when you say you want an epidural, you have to know that you're gonna feel numb, right? And people like that's what they're looking for, no pain. But you don't want to be in such no pain that you can't feel anything.
Yeah.
Um,
Like a balance.
at Piedmont, they use bupivacaine. They do have a catheter in your back. They do have it where it runs the whole time, but they have a certain, I guess, rate that it goes at. And if you do need an extra dose, you can hit a button.
Gotcha.
Um, and it's patient controlled. So I feel like I can still feel when you say that you can't feel anything. That means you need to know what kind of epidural that they're giving you. Is it running continuously into your back through a catheter? Did you ask for an extra dose? Because people realize like, oh, my epidural is wearing off. I'm starting to feel stuff. Well, if you're getting closer to the end of your labor, you want to start to feel something so you don't have to be coached through pushing. Because anytime you're going to be tired, if you're being coached through pushing, you're going to be tired because you're going to be pushed for a long time. Because for one, first we got to practice what the pushing is going to be like. Don't scream while you're pushing. Like, and the nurse is trying to tell you that's me standing at the head of the bed. Okay, that's not it. Let's stop. Let's start again, and we have to go through something else. So you have to go through all of that before you can even get to trying to push the baby out.
Gotcha.
That is a lot. But you don't realize that's a lot, and you'll be tired. And I'm not saying don't get epidural because I'm the number one cheerleader for the epidural. I believe in it. But what I'm saying is just be mindful of how much medication you're getting. Just be mindful of how many times you ask to be redosed because you will numb yourself to a point where, and then the medicine is not long acting because once they turn it off, it'll leave the body, but it's not short acting either. So you can't say, hey, I want to get an extra dose before it's time for me to push because if you're already really numb, you get that extra dose, you can't even get your legs up in the stirrup. They trying to hold your legs up, and it's a lot. So I think those are two big things. For one, already be in tune with what's going on with your body. Even not being pregnant, you should know, hey, oh, I feel like I'm getting sick. I know I'm getting sick. I need to take something to help with that. Hey, or I ate too late last night. Now my stomach all blowed up and I can't go to sleep. Or when you wake up in the morning, you didn't sleep as well because your stomach was blowed up all night and your body was trying to fight to get that out. So even in that, knowing those things, that is even helps. I feel like we need to understand just knowing what's going on in my body. And it's
Absolutely.
important.
Yeah, yeah. So, Allison, I love this. I know we're going to have a separate conversation just about the unique challenges that a nurse has, right? In being pregnant and just with the way y'all schedules are set up, prepping for work, working 12 hours, then having to get off and just balance life. But
Hmm.
if you could, because your birth stories are beautiful, all of the tips that you've given, oh my God, are beautiful, and just your insight, because I think that if you've never been on the inside, you don't know how to prep for being in a hospital for labor and delivery. So you kind of need someone who's not, you don't have a vested interest, right? When people go to birthing classes at a hospital, the hospital is teaching them, right? And so they're going to tell you the things that you need to know to successfully birth at that hospital, to learn their policies and things like that. But you are really just coming from the lens of not only a mom, but someone who's been in the labor and delivery room time after time. And so your insight is completely, completely invaluable, right? But
Yeah.
can you think of advice that you would give to a healthcare provider, advice that you would give to moms and their families, to prep for the type of birth that they want, practical tips, but then also what you think is necessary to cover afterwards?
Okay. So advice
Take
to a
your time.
healthcare provider. Okay. Um, as a nurse, for me, I feel like advice that I would give um another nurse is let the patient do what they want to do. Okay. You as a nurse, you're already gonna have some biases, you're gonna have your opinions, right? Um, but when it comes down to it, at the end of the day, it's still what the patient wants to do within reason, right? Um, it might not be your cup of tea. Sure, you the patient want to sit there and meditate or sit with their legs crossed in the bed. I had a lady who she was on all fours and rolling around. She was on the floor. Don't ever get on the floor of a hospital. But she was on the floor rolling around, and and that's fine. That's what she wanted to do. She didn't have epidural. Her water was broke, but she could still get up and move around. So who am I? You know what I'm saying? And that's what she wanted to do. Let them do that, because a lot of times people feel like they aren't heard. People feel like they're being ignored. People feel like when they had their child that all their what they wanted was stripped from them. So you in the beginning, especially because depending on what kind of birth they're gonna have, depending on what they have going on with their body, depending on what they're dilated and all that kind of stuff, a lot of it plays in the beginning when they first get there. Just give them the opportunity to make some decisions, because at the end they might not have any chance to make a decision, because we have to go ahead and do what we have to do. But in the beginning, when they first get there, yes, okay, you need IV, get the IV, and then you know, hook them up to the monitors. They, you want to walk around, you can walk around. You don't have epidural. You can walk, you can do whatever. It's fine. But we just had to keep you on the monitor, let you walk around, do whatever. But that was my thing. In the beginning, you could do whatever you want to, and you gonna have the body just, and that's another thing. You gonna feel how you want to feel about what the patient said, what they do, what kind of story they have, what kind of plan they have. But always be encouraging and keep your opinions to yourself. You can talk about all you want to at a nurse station, you know, it's fine. Do what you gotta do, but don't share that with the patient. Because for one, already giving birth is already a scary thing. People think, I'm about to die and all this kind of stuff, and the hospital trying to kill me and all. So just keep that away. Just be encouraging to the patient. Let them know that I'm here for you. I'm going to do everything I can to help you, all that kind of stuff. So they know, somebody's in the corner. You know what I'm saying? It's not everybody in the hospital trying to kill me. So
I
that's
love
important.
that. I know you're going to keep going, but I have to say, my midwife, I felt like that was why I trusted her.
Hmm.
say that I needed something until she really knew that I needed something.
Yeah.
And she didn't wait until it got out of hand. She
Yeah.
told me so that we could together make an informed next step. And so, but if all along the way she was planting seeds of doubt, I
Mm-hmm.
know that if she then said, look, we may need to transfer to the hospital, I would have been very opposed to it because I feel like you didn't listen to me the whole time. But that was never an issue. And I think it's because she went into it with the mindset that you're talking about. Just watch and see. And if what they're doing isn't putting them into harm's way, then we just keep going with the plan that they have.
Yeah.
Because why not? Women, when they think about, especially from an ancestral standpoint, I feel like a lot has changed. Sometimes people will say, well, our ancestors did. And it's like, yeah, our ancestors also worked a lot more than we did. And the food wasn't as processed as it is now. And they went into pregnancy more healthy, even if mentally there was a lot of stress. We were used to dealing with stress. We're strong as a culture. And so I feel like things have changed. So when women go in thinking, um, our ancestors did it, and so I can do it. We want that type of confidence for sure, and we want to respect cultures and the belief that our bodies were designed to do this. And if something goes wrong, we also want to be able to say, "I'm going to lay all of that down. What's the next best step?" But it's easier to do with a provider that you can trust, that was on your team to begin with, and it starts.
Mm-hmm.
You said being encouraging and letting them do what is safe to do. Wow.
Mm-hmm. Yeah. So yeah, that's basically what I tried to get my patients to feel in the beginning, because depending on if you was there for induction, which I hate to be like this, but when after I got decently good at it, what I was doing, um, you could tell depending on whether or not you chose to be induced, whether or not you chose, whether somebody who came in natural, 9 times, no, mm, 4 to 5 times out of 10, somebody who chose to be induced on their first baby was going to have a C-section. Just to be honest, because they were not mentally prepared for what they were about to go through. One, two, their body was not ready. Three, they weren't prepared for somebody to tell them that their body was not ready. And so, when you put yourself into that predicament, and that's what people don't realize, you're putting yourself into a situation that you don't even know anything about. So then somebody's presenting you information that you know nothing about. And hey, your baby looking like this, and we're gonna have to do this because if we don't, then this is gonna happen, and so we have to do emergency C-section. And really, it's not emergent. But when they start putting in C-section, people automatically go to the left. So they like, yeah, go ahead and do what you got to do because I don't want nothing happening to my baby. And that's truth. But you need to already know that if I'm going to be induced, there are certain things, especially when my body's not ready, there are certain things that I need to be prepared for. It's just what it is. Yeah.
I love that. So to moms, I feel like you really hit home on why we should not just be saying yes to inductions or asking for it.
Mm-hmm.
And so I love that advice too. Anything else you would like to say before we get off? I feel like this is just wonderful. I always love talking with you because I feel like you're just so real. And honestly, even the way that you share with epidurals,
Mm-hmm.
most people will say, don't get an epidural. And you are a champion for an epidural, but you also explain your knowledge of when too much, how to know too much, if it's too
Mm-hmm.
much, and what is ideal for the beginning of labor versus what you want at the end of
Mm-hmm.
your terms of being able to feel. So I don't know. I just appreciate you sharing your perspectives, your expertise, and your experience because your story is beautiful.
Thank you. No problem. Also, and for mom, for people who are pregnant, and put it like that, people who are pregnant, you can have a birthing plan. Come up with one. I would say that. I mean, for me, I didn't have to write mine down because mine was very simple. I want a healthy baby. I want an epidural. and I will prefer to push it out, the baby out. But if I have to, I'll go with the C-section. But I'm be proponent for pushing it out this whole time. Okay, but see, and that's one thing that I always like to tell people. You can come up with a very detailed, itemized birthing plan. I want this, and I want that, and I want this, and I want that. But know why you're doing it. Okay, know why you want the nurse to sprinkle holy water through the room or spray whatever. I've had some people say some really serious things. I was looking at them like, well, if that's what you want, I'll be in here spraying or whatever. But know why you're doing something, because by the time you get to the end and nothing that you wanted to happen but me spraying that holy oil in the room happened, then you sitting up looking like the hospital robbed me of everything. No, you have to understand why you're doing something, because you had this birthing plan, but then you asked for an induction. Nothing on the birthing plan is gonna happen. I can go ahead and tell you that from the beginning. It's not. So have a birthing plan, but know why you're doing the stuff in the birthing plan. Sure, aromatherapy is good. It helps relax you during labor. Sure, music is good. I had music. It relaxes you during labor. Have the people you want at the bedside who want to come with you. That's fine. But you need to know what you're asking for and why you're asking for stuff. That's just one of my biggest things, because at the end of the day, by the time you only gonna get to the first 3 or 4 checkpoints of that birthing plan, and the rest of it's out the window, because we got stuff we got to do, and it had nothing to do with holy water and aromatherapy and DVDs and playing the PlayStation, and none of that it's gonna be serious after that. I've seen some birthing plans, and they come in with this 12-page long plan, wanting to check all boxes and all this kind of stuff, and I'm like, baby, let me tell you something. And I'm not even gonna be funny. The nurses will say people who come in with birth plans like that will get cut. We would say that, because most of the time when you come in with something like that, the stuff that you should have been focusing on, you was focusing on the stuff in the beginning. You should have been focusing on the stuff at the end. And so that we know that you're not prepared for that at the end. You get what I'm saying? So therefore, you most likely gonna have a C-section, and that's not what you want. That's what I'm saying. If you're gonna have a birthing plan, because I always say, why do people come up with these birthing plans? Well, it's good to have one so you know and everybody else knows what's going on. But don't put dumb stuff in it. I'm just saying. I'm not trying to be rude, but know why you're doing it. It's dumb when you don't know what it's doing. To me, it is. When you don't know why you're doing something, it's dumb.
Yeah, well, I
Especially
think it's
when it comes to that.
right, but I think it is what happens if one part of this does not go the way you expected? What's the
They
next
don't
plan?
do that.
You lose
Mm-hmm.
all control, right?
Mm-hmm.
And
Mm-hmm.
if someone says, "Well, I don't want any interventions," but then they agree to an induction, the induction is an intervention. So from there, everything else that was on there could change, right? Faster than you expected that it
It
would.
will change.
Yeah.
It will change. That's the thing. It could, when you, unless you need it, unless it's necessary. Um, and I don't know why it happens like that, but unless, especially if you have an unnecessary induction, 9 times out of 10, I was saying 4 out of 10, 9 times out of 10, especially on the first baby, you're gonna get cut. I'm just
Wow.
gonna be honest,
Those
because
I feel
it's
like
just like they get to the end and, oh, we're stalled out at 7. We're not gonna be able to go any further than this. And then you in tears, but they telling you got to do it because the baby's gonna be. And so you be like, okay, let's go. And unless you have, that's another thing. When you get pregnant, know where you're gonna have your baby. Know the people that's up there, that they know what they're doing. Know, know what kind of doctor you got. Cause baby, if they get to 5 o'clock and ready to go home, You know what I'm saying? Know if they got midwives. They should always need to go with some midwives. They'll try to give you a little leeway. Um, but if you get up there and the nurse is not helping you out, right? You don't have the turn every 30 minutes like you're supposed to. You're supposed to have a turn every 30 minutes and be on a peanut butter. That is the best. Um, that is the best plan of action to get to a successful vaginal birth. Is turning movement. Movement is the biggest thing that will help keep your cervix open. So get your cervix open. So yeah, you had just do some research, ask some questions. Ask me. I don't care, but ask some questions about what's going on because you won't in the end you'll be able to have what you wanted basically. That's what I'm trying to say. You'll be closer to what you want.
So thank you. We're blessed to have you at Operation Miss, and I'm blessed to have
Yes,
you as a friend. Thank you.
no problem.